Hi, everyone. Good morning. Today we are joined by Dr. Andrew Pavia, Chief of Pediatric Infectious Disease at the University of Utah Health and Director of Epidemiology at Intermountains Primary Children's Hospital to talk about RSV and flu trends at Primary Children's as well as the state of Utah. Andy, thanks so much for joining us. It's nice to see you.
Thanks for having me.
So I want to start with just a simple explanation of what RSV actually is for our viewers in case they've never heard the term before, and also how someone can actually contract RSV as well.
Sure. RSV stands for respiratory syncytial virus. You can see why we use an abbreviation. And it's a virus that affects virtually every child before the age of 2 or 3. It generally causes an illness of cough and wheezing, but some children get very short of breath. Many children have to be hospitalized, and a number require ICU level support. Now, the other interesting thing about RSV that we've really only understood for about the last 6 years is it also causes a lot of infections in older adults, predominantly those over about 75, and accounts for a lot of hospitalizations for pneumonia in older people as well. So it's not just a disease of kids, but it's at the extremes of age. For people in between, older children and for adults, you can get infected again and again, but it usually causes very mild cold symptoms unless you're in that very young or very old age group.
So tell us what's happening now with RSV trends and flu trends at Primary Children's, and then just in general in the state of Utah.
We're seeing something that I have never seen in the last 35 years. And if you go back in the history, really hasn't occurred except very briefly after the 2009 influenza pandemic. That is, there's almost no RSV. We have not hospitalized any children at Primary Children's this year for RSV. Normally, we average about 80 a week. In a really bad year, that might be 120 hospitalizations a week. And about a third of the kids who need to come into the hospital will end up in the intensive care unit. So this is really, truly remarkable. Now, flu is doing pretty much the same thing. There is very, very little flu in the state of Utah. In fact, throughout the country. CDC has only gotten 1,400 reports of confirmed flu. That number by this time of year would normally be in the 500,000 range. So flu is down at pretty much historically low levels. If we go back about 20 years to our previous really low flu year, this is still lower than that.
So question around that number you just said, is that hospitalizations or actual tests done to detect that someone has the flu? Is there a difference in reporting there?
Yeah, the 1,400 is confirmed tests. CDC tracks flu hospitalizations in children. We have had one in Utah. Normally we would have several hundred by this time of year. And nationwide, I don't remember off the top of my head the number of hospitalizations nationwide, but we typically will see about 180 flu deaths in children every year across the country. And in Utah, that translates out to 2 to 4 deaths among children. So not only are we seeing no cases, we're not seeing hospitalization, and thankfully, we're not seeing flu deaths. It's really, truly one of the good side effects, if you will, of the COVID-19 pandemic.
That's really great news. It's great to hear. You would think that there would be cases of RSV and flu just because it's kind of that season for it. So what are some actual explanations for this sharp decrease and kind of this non-existent flu and RSV trend?
Well, they're probably a little bit different for the two viruses. So flu is it circulates in the southern hemisphere in our summer, it circulates in the southern hemisphere and is brought to us multiple times. So it's usually imported. So travel restrictions are probably keeping flu from moving around the world effectively. Masking and physical distancing and better hand washing, we've known for years can control flu, but now we're doing this natural experiment where we're controlling it really dramatically. So those are probably the major explanations for why flu is not here. RSV is somewhat more perplexing because RSV doesn't go away completely every summer. There are cases in the warmer climates year-round. So places like New Orleans and Miami have some RSV year-round. So you'd think that would be our reservoir that would seed it and make RSV pop up this winter, but it's not happening. So clearly, masking is playing a big role, keeping kids more at home, and they're probably not mixing. Infants are probably not mixing with as many other children, and their siblings are not bringing home viruses from school. That's probably playing a role. But there may be some other things that we don't fully understand, because all these things would be expected to drive RSV down to low numbers, but it's practically zero across the nation. Now, one theory that's bandied about is that viruses interfere with each other, and that when one virus dominates the jungle, it forces all the other animals out, essentially. We don't have a lot of good evidence for that. That's only a theory, but viruses have these weird interplays that we don't fully understand.
That's interesting. I've never really thought about the connection between having COVID-19 circulating and kind of pushing those other two away, but it makes sense. And along those lines too, there's a question around the chance of high flu and RSV infection rates maybe next year, because fewer people are getting actually exposed to that. Is that something that could happen? Are you guys worried that there'll be kind of this surge of cases come next winter?
Yeah, absolutely. It's very likely that when both flu and RSV have been away for a while, you have more people fully susceptible to it. So when it arrives, it spreads more dramatically and we see more severe disease. With flu, we often see these oscillations where you'll have, after a very mild year, we'll see more severe disease. And that's in part due to decrease in immunity, but because flu changes every year, that one is a little bit hard to predict. Now, RSV is different because it depends a lot on every year having a new crop of babies who are completely susceptible to RSV. In Utah, that's another 50,000 good hosts for the virus to attack. And this year, we're going to have a whole year of infants who never saw RSV. So next year, we'll have twice as many completely naive infants who are susceptible to it. Now, we've gotten a little bit of a warning that I just learned about really Friday evening from colleagues in Australia, in Western Australia. They were the first to tell us that RSV was absent during the previous winter when COVID was circulating. And as many of you know, in Australia, they've gotten COVID levels down to extraordinary low levels because of quarantine of arriving people, because of very good mask use, and because of a number of other just very good, strong adherence to social distancing and control measures. So they started to let up, and they have increased travel and public gatherings. Mask use has gone down. And in Western Australia, they're seeing a huge surge in RSV, higher than they have in any normal year. And what's even stranger than the really high surge is that it's happening in the middle of the Australian summer. And that's really unheard of, even in Australia, which has a more temperate climate with less severe winters. So RSV is going to do something really strange when it comes back. We really can't predict it very well. Our gut feeling is that it will come back, roaring back, and that we'll have a bad RSV year when it does return. Is that going to be in our summer? Is it going to be next winter? Will it skip another year? I could make predictions, but I'd be a fool to do that. I'd be wrong.
Are there ways that parents or people who are around infants can help protect their child or whoever they know from contracting RSV when it starts to kind of make its existence known back again?
We've known for years that you can protect your kids from RSV to a pretty high extent. Hand washing is very important with RSV. In adults, we get runny noses when we're carrying RSV, and of course, the other children who are carrying it get runny noses. So contact with respiratory secretions is really the primary way that RSV spreads. Masks probably help. It's not as clear-cut as it is for flu and for COVID. But, of course, if you're wearing a mask, you can't touch your runny nose, so that plays a role. So we tell parents who have premature infants, for example, that you really want to try and keep your other children from getting sick and coming home with viruses. You want to insist on strict hand washing. when people come into the house. You don't want your infant around anybody else who is sick. And that's what we tell parents of premature infants, because RSV is worse for them. That's really good advice for any infant, but people follow it better when their baby is more vulnerable, like for a premature infant.
Someone else just asked a question around, is it possible that cases of RSV are being reclassified as COVID in children or adults necessarily? Is there a way for those to kind of mix and get messed up in test results, or is that not possible?
So the tests we use are very specific. And in fact, one of the platforms we use, one of the tests that we use a lot here at Primary Children's, tests for COVID, flu, and RSV at the same time. So it gives you an accurate result as to which virus the child has. We use another test for sicker kids and kids in special circumstances that identifies 17 different viruses, all quite accurately without any crossover or cross detection. So it's possible that there's a little bit less testing done some places, but that's not what's going on here. This is really a situation where the virus isn't here in spite of our looking for it.
I want to go back to the flu really quick too. Is there a chance that wearing masks and staying home could potentially lessen the flu cases in children for years to come as well? I know you mentioned that there's some correlation, but what about further down the road?
Well, Dr. Fauci, who is usually right, said that we may want to keep wearing masks during the winter for, some part of the foreseeable future. If we do that to protect against recurrent winter surges of COVID-19, my prediction would be that that would decrease the amount of influenza and perhaps the severity of influenza we see, and it might have a similar effect on RSV. But we're really going to have to wait and see. As many people have traveled a lot know, in Asia, particularly in East Asia, it is very common to wear masks in public during flu season. And that seems to help prevent flu, particularly among the elderly and the more vulnerable.
And is there any relationship between pediatric rates of the flu and RSV related to those adult cases? Do they kind of correspond together, or is it vary in terms of the number of cases per each?
Well, there's a very tight and complicated relationship between flu in children and adults. We've done some work a few years ago, which other people have confirmed, where every year flu tends to spread most rapidly in school age and high school age children first, before it starts to spread more rapidly among younger children and older adults. So kids play an important role with flu, which they don't with COVID, as being one of the amplifying groups. RSV is also pretty interesting in that when we see severe cases among elderly people, it's often at a time when their grandkids had either what's clear-cut RSV, or they had a cold that may have been due to RSV. So, it will pay in the future to wash your hands around your grandkids if you're an older, susceptible adult.
Another question around the elimination of RSV and flu. You mentioned earlier that we could potentially see a surge come summer or winter, depending on when it happens. Is there a possibility that we could also eliminate either of those two with the public health measures that we're taking, since we haven't really seen them in the last year?
For flu, that's an easy answer. No, it can't happen. Flu infects dozens and dozens and dozens of different kinds of animal reservoir, wild birds, domestic chickens, wild ducks. But you've probably heard that tigers and dogs and even dolphins can get flu. So these strains of flu out there are a reservoir. So, I'm a flu researcher. I'd love to say one day we'll eliminate flu. It's not going to happen in my lifetime if I live to be 150. RSV, we know a little bit less about where it goes to hide. The RSV that we know and see in children really only has a human reservoir. Nonetheless, I just don't think that we're going to eliminate RSV.
Another question for you too, and this has to do with COVID specifically. What are our case trends like for pediatric cases of COVID? I know you and I talked last summer, so it's been a long time since we've had this conversation, but have we learned anything about pediatric COVID and those kind of trends between the two?
Yeah, we've learned a lot about COVID in children. One thing that we've seen, of course, which is what we thought we knew last summer, is that most children are going to get milder disease, and many will be asymptomatic. But even though only a small percentage of kids get severe disease and a very small percent die, with the massive amounts of COVID-19 we've seen in the United States, that has added up. So as of this week, CDC reports about 240 deaths in children due to COVID. Now, that doesn't sound like a lot, but that's more than in all but the very worst flu years. And this from a disease that, tends to spare kids. We've learned that younger children, for the most of the data suggests they're a little bit harder to infect, and they're not as good at infecting other people. So the preschooler and the very young school-age child has a little bit of a special protection against both being infected and shedding. That's not to say they don't, because they do get infected and they do spread, but they do it less efficiently than older children, teenagers, and adults. Now, the other thing we've learned is that teenagers are a lot closer to adults in terms of how they deal with COVID. They may not be very adult-like in some of the decision-making they do, but they can get very sick. They can get infected readily, and they can transmit it, although many will have mild or moderate disease. And then the last thing that I don't know if we talked about last time, but I've talked about in other formats, is this unusual but scary complication of COVID-19 infection that we see several weeks after the initial infection, called multisystem inflammatory syndrome in children, or MIS-C. And even though that is a fairly rare complication, when you multiply it through the hundreds of thousands of children who've been infected, that has led to a very large number of cases around the country. And I don't have the latest number, but last I checked, we'd had over 75 children with MIS-C at Primary Children's. Many of these kids have been critically ill, have been in the intensive care unit, have required pretty extraordinary treatments. The good news is that although there have been a few deaths nationwide, all of the kids we've taken care of so far have survived.
A question on MIS-C, is there a way to kind of tell if your child is experiencing symptoms related to that, or maybe something else? Like, when's the indication that you should go to the hospital if needed for something like that?
That's a very good question. It tends to be a pretty severe disease. It often starts out with abdominal pain and diarrhea, and then high fevers begin. But we usually recognize that it's MIS-C because children are starting to get quite sick. They may be listless, they may be vomiting, they may be short of breath. And all of these things are things that would obviously make you bring your child in to be checked out. If you have a child who's experiencing 24 hours of diarrhea and looks well, don't worry about it. That's a common thing to see. If they have a fever that's accompanied by a sore ear, you probably want to talk to your pediatrician or family practitioner about it, but you don't want to worry. But if your child looks very sick, if they're listless, they can't eat, and you're worried, by all means, bring them in. It's probably worth emphasizing that clinics and EDs and pediatrician and family physician offices are now pretty safe places. Everyone is masking, the clinicians are vaccinated, so you shouldn't fear bringing your child in if they need to be seen.
I think that's a great piece of advice too. And when in doubt, if you have a question, I think reaching out to your pediatrician is a great way to go, because like you said, if your child is starting to appear sick, it's better to get them checked just in case. So I think that's great advice. I have another question for you too around RSV and treatment. How do you typically treat RSV if you get a case of that at Primary Children's?
Well, as of today, the treatment is supportive. So what that means is we help the child to breathe. We give them extra oxygen if we need it. They usually are having trouble breathing because of huge amounts of secretion in their nose. So we suction the secretions out of their nose. If they get a lot sicker, they may need a breathing tube, or they may need non-invasive ventilation, which is pressured mask that helps children to breathe. The other thing that happens to many young infants who've got bad RSV is they are having too much trouble breathing to be able to take a bottle or to eat well. And so we give them fluids that not only helps them give them the fluids they need, but it helps keep the secretions loose and helps them breathe. And home care is very similar. So most kids with RSV are cared for successfully at home. You will teach the parents to do nasal suctioning. We'll help them to make sure that they're keeping their child well hydrated and to check for wet diapers and to look for things like blue lips or listlessness that might suggest they're not getting enough oxygen and they need to come into the emergency department. But again, if in doubt, talk to your pediatrician or bring your child in.
Last question for you. What do you predict for the future with RSV and the flu? Where do you think this is kind of going to go from here?
Well, I hate questions that start with what do you predict for the future? Because, it's a reminder to be humble. I think that there's not much doubt in my mind that RSV will be back. And the first year it comes back, it's likely to be a very bad RSV year. I have no idea if we're going to have an off the calendar, RSV year where it happens at a time when we don't expect it. We usually expect RSV to show up, sometime between December and January, kind of like a lackadaisical Santa who can't check his calendar. But it might be off. Flu, my best guess is that the first year it comes back will be a bad year, but there's so many other things that go into flu that's a much more difficult prediction to make. And I hope that we'll have changed our behavior enough in terms of hand washing, staying apart from each other when we're sick, not going to work when we're sick, wearing a mask if we're really vulnerable, that maybe we'll make a major dent in these diseases in the future. And there's one more thing I'd like to add about RSV. For the past 20 years, people have been working really hard to develop a vaccine for RSV. And it's been a really uphill struggle. But in the last 2 or 3 years, we've seen better preliminary results than we ever have before. And some of the advances that have been made in vaccines around COVID-19 will probably really accelerate the development of RSV vaccines. Those are going to be really important, not just for babies, but also for older adults.
That's really interesting. I actually, Lad, I have one more question for you that just came in. Someone asked that they've seen a huge part of the Hispanic population being impacted by COVID-19. Is that typically the same for RSV and the flu as well?
We don't have the really big health disparities for flu and RSV, but because some of the same factors that have the health disparities that have made COVID-19 worse for some communities do play a role in flu and RSV. If you have a lot of people living under one roof, if you have trouble with running water, these are all things that will increase the spread of those diseases. Of course, if you don't have good access to medical care, your child may stay home longer and get in trouble and need to be hospitalized, or maybe you won't get everyone in the family vaccinated against flu to protect your vulnerable infants. So, we see health disparities in everything we do, and we're finally trying to really get our hands around them and do things to improve those disparities. And they exist, but COVID-19 has really just opened our eyes to how big and how deadly those disparities are.
Yes, and I appreciate that. I think that as we kind of move forward into the future, that's something that all healthcare systems will hopefully continue to work on. So, Dr. Pavia, thank you so much for joining us and having this conversation with us today. We really appreciate it, and we will talk to you next time. Thank you.
Well, thanks for having me, and stay healthy and wash your hands and wear your mask, and maybe by summer we'll be done with some of this.
Sounds good. Have a good day.